All right, today we're diving into a medical marvel that chances are you've probably come across yourself. We're talking about one of the most prescribed antibiotics on the entire planet, doxycycline.
I mean, think about that for a second. How can one single pill be used to treat something like acne and also Lyme disease and even anthrax? The range is just incredible, right? From a common skin issue all the way to a bioterrorism defense. So what's the secret? How does this one pill do it all? Well, let's get into it.
Okay, so first things first. Let's cover the basics. What exactly is doxycycline, and why is it such a go-to for doctors pretty much everywhere?
So doxycycline is a really powerful broad-spectrum antibiotic. That just means it works against a wide variety of bacteria. It's part of the tetracycline family, but it has some key advantages that make it stand out. For one, your body absorbs it incredibly well. And it has what's called a long half-life, which basically means it hangs around in your system, doing its job for a longer period of time. What that translates to for you, the patient, is often a super simple dosing schedule, maybe just once or twice a day. And honestly, that convenience is a huge part of why it's so popular.
All right, so we know it's effective, but how does it actually work? On a microscopic level, how does it stop an infection dead in its tracks? The way it does this is actually pretty brilliant. And for the bacteria, kind of brutal.
Okay, I want you to picture a bacterium as this tiny, bustling factory. Its whole job is to churn out proteins, nonstop. That's how it survives, that's how it multiplies. Now, in comes doxycycline, and it's basically a master saboteur. It sneaks right into the factory, finds the main assembly line, that's called the ribosome, and it just throws a wrench in the works. It latches onto a critical part of that machinery and physically blocks any new building materials from being added to the line. And just like that, the entire protein factory grinds to a complete halt.
And this brings us to a really important idea. Doxycycline is what we call bacteriostatic. Now that sounds technical, but it just means it doesn't usually kill the bacteria outright. It's not a bomb that wipes everything out. Instead, it just stops them from reproducing. It freezes them in place, preventing them from making more of themselves. So it's basically holding the enemy at bay, which then gives your own immune system the perfect chance to swoop in and clean up the mess. It's less of an assassin and more of a strategic partner for your body.
Okay, so now we know how it works. It shuts down the factory. So let's get back to that original question. Why can it treat so many different things? This is where that broad spectrum idea really shines.
I mean, just look at this list. The versatility is mind-boggling. You've got your more common stuff, right? Respiratory infections like pneumonia, skin conditions like acne and rosacea. Then it's a key player against STIs like chlamydia, but its reach goes way beyond that. It's absolutely critical for treating serious tick-borne illnesses, including Lyme disease, and it can even be used as a preventative for malaria. The sheer scope of what this one drug can do is, well, it's just massive.
Now, a drug this powerful really demands respect. Seriously, how you take it is every bit as important as why you're taking it. And when it comes to doxycycline, there are a few rules that are absolutely non-negotiable.
Okay, if you take away only one single thing from this entire discussion, please let it be this. This is not just a friendly suggestion, it's a critical safety instruction. You have to take this pill with a full glass of water. And you need to stay sitting up or standing for at least 30 minutes after you swallow it. Don't lie down.
And here is exactly why that rule is so important. If you don't use enough water, that little pill can literally get stuck in your esophagus on the way down. And if it dissolves there, oh, it's bad. It can cause severe irritation and incredibly painful ulcers. So that full glass of water isn't just to help you swallow. It's to make sure the pill gets flushed all the way down to the stomach where it's supposed to be.
The other really big thing to know is timing, especially around certain foods and supplements. Things like milk or cheese and acids with calcium or even iron supplements, the minerals in them can actually grab onto the doxycycline in your stomach and stop your body from absorbing it properly. The drug basically gets neutralized before it can even get to work. That's why you have to space them out. Wait at least a couple of hours after you take your pill before you have any of that stuff. You've got to give the medicine a clear path to do its job.
Of course, like any effective medicine, this one isn't without its potential downsides. So let's talk about the common side effects and, more importantly, some of the really serious warnings you need to know about.
Okay, so the things you're most likely to run into are stomach issues, nausea, maybe some diarrhea. And we've already covered that risk of esophageal irritation if you're not careful. But there's another really common one that catches a lot of people by surprise, and that's photosensitivity.
Yeah, this is a really big one, so listen up.
Doxycycline can make your skin way more sensitive to the sun. I'm talking you can get a nasty, blistering sunburn in a fraction of the time it would normally take. So if you're taking this stuff, sunscreen is not optional. Wearing a hat, protective clothing, avoiding being out in the direct sun for too long, all of that becomes absolutely essential.
All right, now for what is probably the single most critical warning. Doxycycline should not be used by pregnant women or by children under 8 years old. And the reason is very specific. It can actually bind to calcium in developing bones and teeth. For teeth, this can cause permanent discoloration, a sort of yellow-gray brown staining that won't go away.
But there's an exception. Medicine is always about weighing the risks versus the benefits, right? So in a truly life-threatening situation, the classic example is a child with suspected Rocky Mountain spotted fever, which can be deadly. A doctor might make the call. They'll decide that the benefit of saving that child's life far outweighs the risk of potential tooth discoloration. It's a tough call, but a necessary one.
So, as we start to wrap up, it's clear doxycycline is an amazing tool. But like any powerful tool, it doesn't exist in a vacuum. You have to use it correctly, and you have to understand how it plays with other things in your system.
And we're not just talking about food and supplements here. It can have some major interactions with other prescription drugs. For example, it can make blood thinners like warfarin much stronger, which is dangerous. Or if you combine it with certain other acne meds, it can increase the risk of a really serious condition involving pressure building up inside your skull. This is exactly why it is so important that your doctor and pharmacist know every single thing you are taking, no exceptions.
So when you step back and look at the whole picture, its incredible effectiveness against so many different bacteria, its simple dosing, and its generally well understood safety rules, it becomes crystal clear why doxycycline is still an absolutely essential weapon in the modern medical arsenal. There's no doubt about it. Doxycycline is a remarkable drug. It's a powerful ally that has saved countless lives. And that leaves us with one last really important thought. In a world where we're facing the growing threat of antibiotic resistance, are we all doing our part to use this precious tool as wisely as we can, to make sure it's still around and still effective for the people who will need it tomorrow?